Lots of people with epilepsy often complain about being nervous, irritable, not happy, or sad. So what is causing that? So we know that depression and anxiety are having very high percentage in people with epilepsy. In general population, the percentage of anxiety and depressions is about 5 to 15%. And in epilepsy, it can reach up to 30 to even 50%. And because the brain can have changes in epilepsy, and it's a network disease and network condition, the same thing happens in depression and anxiety. The network can get out of sync, and that can cause those symptoms. So it is important to treat that, because treating anxiety and depression is a key in treating epilepsy and seizures. If you have depression and anxiety, your quality of life will be worse, and the seizures will not be very good controlled. And then if you treat anxiety and depression itself, then the quality of life will improve, and the seizure control will also be improved and get better. So what causes anxiety and depression in epilepsy? There are multiple causes. The first thing, it just happens with epilepsy because it just happens like anyone in population, but in epilepsy happens more. The second thing, it can be a side effect of medications. One of the most common medications used for epilepsy treatment is levetiracetam or Keppra, and one of the major psychiatric side effects are depression and anxiety. So very important, if you have anxiety and depression, you should not be taking Keppra. So discuss with your doctor if the Keppra is the good choice for you. Other than side effect of medication, you're having chronic condition, and the chronic illness is associated with anxiety and depression. So now we know what causes depression and anxiety. So how can we treat it? So actually the treatment is pretty straightforward and available. So the first thing is, if you have any medication that might be causing depression and anxiety, such as Keppra, levetiracetam, or Pyramberil, Fycompa, those medications can cause depression as a side effect. So stop them and switch them to something different with your doctor. It can be a good option. And one of the seizure medications like lamotrigine, which is Lamictal, and the valproic acid, Depakote, they fight depression and anxiety and can cure them. And other thing is psychotherapy. So psychotherapy is very important. You sit with a psychologist, a therapist. It helps you to process the information in the brain, and it helps anxiety and depression. And the third thing is antidepressant medication, or SSRI or SNRI. Those medications are designed to replenish the chemistry and restore the balance in the brain, which is like really happens in the brain. And depression is a condition like any other condition in the brain. It can affect it, and the symptoms are sadness and other things. And those antidepressants are safe in epilepsy. If you read the insert package, it will say seizures. Be worried about that. But usually seizures does not happen with those medications. It happens only if there is a toxicity, means that you're taking too much of the medication. So treating depression and anxiety is essentially important in treating epilepsy, and it should be considered all the time, so to improve your quality of life. And to learn more about other anti-epileptic medications and seizures, to choose with you and your doctor what is the best for you, you can watch this video, and stay healthy, and see you in the next one. Salam.